Welcome to another episode of Dr. Rob, Pain Detective. I'm your host, Dr. Rob Pomahawk. On tonight's episode, we'll be talking to Indigo from Los Angeles, a 14-year-old student. She's also an entrepreneur selling vintage clothes online. We'll be discussing what it's been like to go to school online and a couple other cool things. And we're back. Indigo, welcome to the show.
Nice to meet you.
Pleasure to have you here. So let's review what happened. School was going as planned, and obviously COVID hit, and then all of a sudden, everything was online.
Yeah.
So how was that for you as a high school student going into end of the year exams? What happened?
I mean, it was the second half of my freshman year, and it was relatively boring up until it happened. So it's kind of interesting. But the transition was fine. Same old curriculum, just more diminished.
So when you say it was diminished, what do you mean by that? So time was the same start time and was the same start time? I mean, you were sort of in school for the full amount of time that you were when you were in person, or was that time reduced, or what was that like?
The entire school schedule changed. I mean, they gave out assignments online on Google Classroom, and it was they uploaded it around 8, but we could do it until the deadline, which was midnight.
Okay.
Yeah.
And were you able to get all your schoolwork done in the time frame allowed, or did you feel like you were a little bit leisure because there was no guidance from the teachers?
There was definite leisure. I could finish it within 20 minutes to an hour, depending on what it was.
So the school work was easier. There wasn't as much of it. It wasn't as demanding. What made it so that you could finish in a less amount of time as compared to when you're in school?
There was way less. I mean, in school, you're in class for up to 60 minutes with the teacher every day, and the teacher just explains the subject over and over again. So if you don't have that online, then everything's going to be more shrunken.
So did you have to spend more time doing your own research in order to understand what the curriculum was teaching, or how did that happen?
Oh yeah, the teachers plural barely gave out any information with each assignment. So I usually tended to Google it in order to finish the subject.
So more of it was on your situation to handle what needed to be taught, and less was placed on the teachers. Do you feel like the level of education that you were getting was at the same level as when you're in class compared to now? It seems like it wasn't.
No. I don't know if it's a personal thing or not, but I feel like I learned more when I was in class because there was more information given by the teachers than versus online when it was just words on paper.
And then when you're in the online setting, was it in small pods? Were you able to interact with other kids? Or did it feel like you're just still alone by yourself?
I was pretty much alone by myself. The teachers encouraged social interaction with each other in commenting on each other's documents, but we never really interacted with each other outside of that. We were placed in groups sometimes, depending on what was due that week, but it was nothing really.
So you're in the 9th grade, going to the 10th grade. Did you miss your friends? Was that sort of part of what school's about? Because you're transferring from a different school to this new school. You're meeting all these new people, and all of a sudden you're I'm by myself now. What was that like?
I lost a lot of my friends during this. The people that I usually tended to talk to in the hallways, in class, outside of class, it shrunk from a lot to barely a few that I still kept in touch with afterwards.
And now are you keeping in touch with them, or do you think that because this situation is going to be going over to the new school year, it's going to be the same sort of situation, or do you think it's going to become any better than it was the previous semester?
I think with online school, it's going to be better than how it was because it was just kind of unexpected quarantine, and they had all of summer and the duration of the school year to figure out what they're going to do for the upcoming school year. But I doubt I'm going to see or interact with much people.
And you said that they didn't give you exams.
Barely. It was
So how did you get a grade?
It was basically participatory factor on if we completed it or not.
Wow.
Yeah.
Sounds strange.
It was bland.
Yeah. And then you were on a computer that was given to you by the school, is that correct?
It was a school-issued Chromebook.
So spending more screen time than you're probably used to, because when you're in school for the time frame you're in, you're not actually looking at a screen for the most part, and now you're asked to look at a screen even more.
Yeah, I spent like at least 5 hours on the Chromebook doing my assignments.
Plus working on your phone, right? So you're spending time there. So on a given day, how much more time do you think you're spent on a phone or on a tablet or on a laptop, because now you can't interact with other kids, and now you said you had 5 more hours of working in front of a computer. So on a daily basis, how much time do you think you spend on a screen?
I mean, before, I think I tended to spend like up to 5-6 hours on my phone.
On a day?
Yeah.
Okay.
All right. But with like the added factor of schoolwork, it like probably added 3-4 more hours. So 10, 11 maybe.
So now pretty much while you're awake, you're in front of a screen.
Yeah.
Because you couldn't exercise, or you couldn't have PT because that wasn't offered. You could only go outside at some points.
My PE teacher actually encouraged getting outside and moving and working out. So her idea of assignments in order to get a grade were to fill out logs of what we did.
When you spent so much time on the screen, did you feel different in terms of emotions? Did you feel like you're sort of getting more depressed? Were any of those experiences or emotions starting to happen because the lack of interaction with your friends and how much time you spent in front of a screen?
I actually got happier during quarantine with like the stress amount of school going down. I had more time to think about myself and spend more quality time, because before I was completely stressed out over finals, assignments, tests, and we didn't really have that during quarantine. And plus, with the social factor being lost and not interacting with people I don't like, I felt happier.
What do you miss most about going to school versus what your system is like now?
The only thing I miss about going to school is seeing people that I knew.
Okay.
Yeah.
Interesting. And do you think you'll maintain those friendships when you get back into the school system, or what are your thoughts on that?
I mean, the upcoming school year, I'm not going to go back to school for the first semester, so I'm not going to interact with those people. But if we do get back to school, I think I'll still be friends with them if I see them.
Are you interacting with them via text, via phone, via social media? What's your thoughts on that?
Social media, I mean, it's just not the same as seeing them in person and in school and having their help with school assignments.
And do you feel like you're spending more time on social media now because you don't have any other curricular activities to do? So that way your phone's in front of you and you're spending more time on it? Or do you feel like, has that changed at all?
I used to spend a lot of time on social media pre-quarantine, and I definitely spent a lot more time on social media once quarantine started. But then like my interest in that and then like other platforms like YouTube or TikTok or Instagram, Snapchat, all of that went gone because the amount of I overused it.
So you're spending less time on social media than you were before?
Yeah.
Well, that's a good thing.
Yeah.
Right.
I started reading more.
Nice. And then you said you also sort of run your own business selling cool pieces of clothing, or how does that whole thing work?
Yeah, I actually started that during quarantine because I had like all these clothes that I didn't want, so I started selling them.
Wow.
Yeah.
So you became an entrepreneur because of the lockdown.
I guess so.
And how's that going?
It's going nice. I've been selling up to like 5 items a week.
Wow.
Yeah.
What other hobbies have you picked up because you can't go outside as much or do things, or what else have you sort of been trying to create or do for yourself?
I've been writing short stories and I've been trying to send them into contests in order to like win something, I guess, or just for fun. I think that's it.
So your creative mind has sort of been released a little bit more because now you have more time to think.
Yeah.
Oh, so you're kind of following your dad's footsteps.
Yeah. I've started cooking more. I learned how to cook. I didn't know how to cook before.
Wow. What's your favorite dish?
Spaghetti.
Okay.
Yeah.
Okay. So boiling water, throwing it in there?
Yeah, yeah.
All right, not bad. Anything out of the ordinary where you have to sort of read directions or instructions? Have you tried anything sort of unique where you're like, whoa, it didn't work out so well?
I made pink spaghetti.
Oh.
Yeah.
Okay. How do you make that?
Tomato and cream cheese. And I didn't really like it,
Okay.
if I'm going to be honest.
So part of what we did with you is we examined your posture and your x-rays, and we want to do a comparative study of what your x-rays look like when you're standing normally and what your x-rays look like when you're on a computer on a phone. We also did that for your posture. So we're going to bring up your analysis of regular you and then social media phone you. So that's going to be our next segment coming up. Cool. You ready?
Yeah.
Awesome. And welcome back. So what we did with this young lady is we shot 2 posture evaluations and 2 x-rays. We shot her normal posture where she was standing up nice and tall. And then we took a look at what she was doing when she's spending way too much time in front of a screen. So what we're going to do is examine her posture first, and then we'll examine her x-ray second, and the physical consequences of spending way too much time in front of a computer, a laptop, or a phone. Here is your posture, okay? The green line indicates where you're supposed to be. The red line indicates where you are.
Oh. Wow.
Yeah. The green line separates the body in half from the front to the back. The muscles in front bring you forward. The muscles behind bring you back. So we take a look at what we're evaluating here. Everything has a numerical assessment. We're not guessing. We're not wondering. It's numbers. Numbers don't lie. So you take a look at the lines. You can obviously see where your head is compared to where it's supposed to be.
Yeah.
Based upon your height and your weight, head weighs approximately 9.4 pounds. You're shifted 1.2 inches forward, right? Your head weighs approximately 9.4 pounds based upon your height and weight, but with that forward position, it now weighs 20.8 pounds. So on a daily basis, you're carrying around an extra bowling ball around in front of you. An extra 10, 11 pounds of pressure forward makes all your muscles work too much. And then your hand position is not supposed to be there either. Instead of being your hands in your front pocket, it's supposed to be in your side pocket. When your hands are in that position, you're actually rolling your shoulders forward. So tension and pressure in your neck and your shoulders, headaches are all related to poor posture. So when you have that positioning right there, this is what happens. Upper cross posture. So watch over there. When your hands are in a forward position and your head's in a forward position, and you're not even doing anything, just standing, this is the amount of pressure your body's placing on itself at all times. So then you wonder why you get tired, you get fatigued, you feel knots and sorenesses because I'm carrying my pressure there. Nothing to do with that. It's the fact that you're standing with not very good posture, and we should alter that. Now, the interesting thing is that we also shot your posture with you looking down at your phone. And you want to see what we got there?
Sure.
Let's take a look. That's you looking at your phone.
Not pretty.
No. So the previous posture that we shot, you had 20 pounds of pressure on your body. What do we have here?
50.
So that's 30 more pounds of pressure you're placing on your spine, your muscles, your joints. All those different muscle groups are working that much more. Now look what happens to your shoulders here. The previous posture, we had a pretty good line until the neck, right? Look what's happening here from the hips to the shoulders. Look how you're going back and then you're going forward. That's pretty crazy. And the fact that you said you spent how many hours a day looking in front of a computer, a laptop, or your phone?
Up to 10, 11.
Yeah, so you're spending 10 hours a day in that posture. What do you think is going to happen to your posture as you get older? Do you think it's going to get better or worse if you keep doing that?
No, I'll get more hunched over.
Yeah. And like you said, you had a friend that you saw in school, and what was his posture like?
Like an L.
Yeah, pretty crazy.
Yeah.
So now you see what happens and why it's super important that we educate our parents, we educate our kids on the effects of using too much screen time when it comes to posture and what happens to you on a regular basis. So that's what happened to our posture. Next, we'll also look at your x-rays. You ready for that?
All right.
All right, here we go. Here we go. So here are your x-rays. The left picture indicates your posture x-ray when you're standing up nice and tall, and the picture on the right was when you're looking down at your phone. Okay? The green line indicates where you're supposed to be, and the red line indicates where you are.
All right.
So in both pictures, you're not where you're supposed to be. That's obvious. So even in your nice, good posture, you have a pretty severe loss of curve, right? But then look at your other picture. You see the numbers up there where it says loss of curve? You went from 104% loss of curve to 115% loss of curve. An 11% change of structural posture, right? So that's pretty significant. Now, even in your first picture, that's a huge number, right? What do you think about that?
I don't really like it. I don't see a curve at all.
Surprised by that?
Not really.
Okay. So you spending that much time in front of a computer, in front of your iPads, in school now, being in front of a laptop, you're spending that much more time with that structural posture. And the problem with having that is that your body breaks down faster than it should. We shouldn't be seeing structural postural losses of that magnitude at your age. That's something that my age people should be having. So you're starting to acquire these structural pathologies at an earlier age because you're spending so much more time in front of a computer, even more time because now we're stuck at home learning from a distance. So when you're having that loss of curve, what happens is, okay, so here's a normal picture of an x-ray, okay? That's a bone structure, the brown things. The blue thing is your disc, your shock absorber. The yellow is the nerve, okay? And then, so it's a picture of a spine facing to the left. When you have a loss of curve, what's actually happening inside your body is this. So arthritis is not age-related. It's abnormal increased load related. So the bones are loading more on the front. The disc has more load or pressure on it, which is causing the nerve to be problematic. When that's happening, more so when you're in a flex position looking at your phone, it's still happening in a neutral position, but that plays a role when it affects your muscles. So when you're having a structural pathology at C1, it affects those green muscles. So now we're seeing kids at an earlier age start complaining of tension and pressure and soreness and muscle aches when they shouldn't be having these things, but they're having them more often because what are you doing? Looking down, right? When you get to C2, look what happens here. Then you get to C3 and 4, 6, and 7. Do you feel by the end of the day you start feeling more tightness and soreness in your neck and your shoulder than you were before you were in school, in live school? So now you know why, right?
Yeah.
So one of the things that we have to really teach our youth is how to use a phone, right? So instead of looking down at your phone because the phone isn't that heavy, you want to look up at your phone. And the problem when you're having that structural loss of curve, what actually happens is this. So here's a picture of your spine. Okay, this is a nice natural curve, right, of 42 degrees, which you do not have, right? And so the reason that this is super important is because when you're having a loss of curve, what happens to your structural system over a period of time that's occurring earlier than it should is this. So the curve starts to break down, and then the loss of curve is happening. And then right where my arrow is right here, you start getting decreased disc space or degenerative disc disease, disc herniations, things of that nature. A little bone spur, early on stage arthritis, and a massive loss of curve. Then these bones start to fuse together. And this is all going to happen in your structural system unless you put the curve back into place. And that's what I do, and that's what 2,000 doctors in America do, because we think it's super important that you have a good quality of health because all those muscles inside your body are being dramatically broken down faster than they should. In addition to this, what also is happening is this. Here's a picture of your spine breaking down. Okay, right here we can kind of see a couple things right here, and things are starting to get inflamed. You see this big yellow thing right there?
Yeah.
That's your central nervous system. The other yellow little thing right there, that's your peripheral nervous system. Then see that red thing on the front right there? That's your vertebral artery. When you have a loss of curve in your structural system, all those pieces get inflamed. So internally what's actually happening is your central nervous system velocity, the speed at which your brain and your body are talking to one another, actually gets altered. It's actually affected by 20%. So nothing's working as well as it should. Then your vertebral artery also has a reduction of blood supply and oxygen to your brain and your body. Pretty important to have oxygen and blood supply to your body. And imagine every nerve, every organ, every muscle, every tissue firing improperly or a sequence that's higher than it's supposed to be. Your body's breaking down. There's even been research showing telomere length. What telomere length indicates is longevity of life. When you have a loss of curve in your structural system of your spine, it's actually reducing that, which means the longevity of your life is also being reduced. So it's not just about your muscles that you're feeling and soreness and achiness, it's also internal health. All the things that are super important are starting to break down at an earlier age. And that's why I think it's super important for anybody, even at your age, to get evaluated, understand how you should be using social media, your phone, your computer, sitting in front of your laptop when you're sitting there for 6, 8, 10 hours, or even when you're being an entrepreneur, to change your posture. Because like your dad told you when you were younger, good posture, good health, bad posture, bad health. So if you're not going to listen to it back then, you probably should now.
Yeah.
Yeah. What do you think about this stuff right here?
I don't really like it. I don't really want it.
Something that you want to change?
Yeah.
Yeah. So what we're going to do is going to show you a couple tips in terms of how to improve your posture. Why? Because we think it's super important. Okay. So the key things that I tell my patients or my young people is stop bringing your head to your hand and bring your hand to your head. So tonight when you're going to be brushing your teeth, don't hold your toothbrush here. It's not very heavy. Bring it up to your head. When you're on your phone talking to somebody, don't bring your head to the phone. Bring the phone to the head. When you're drinking your water, where are you going to be doing it? Right here. When you're driving home with your parent tonight, what are you going to do with your head on the headrest? You're going to use it. It's called the headrest for a reason. So as long as you're mindful of always elevating and not bringing yourself down, body language, depression, anxiety by how you appear, but always elevating, you'll even look better in your pictures.
All right.
Fair enough?
Yeah.
Okay. So now what we're going to do here is we're going to compare a good structural alignment and how it affects the discs, ligaments, and spinal cord in a digital motion x-ray, and what's happening to your system when you have a loss of curve. So you ready for this? So when you have natural motion of your body moving back and forth, the discs, the ligaments, and the spinal cord, there's no pressure on them. Nothing is turning red, right? So that's not your x-ray. So moving back and forth, everything's working great. There's no pressure on the system. And it's doing a wonderful job because once again, we're having that 42-degree curve. And our job here is look at your curve, bring it back to the right position by doing structural correction therapy and decompression therapy. So in this picture here, there's a loss of curve, similar to what you're going on in your neck, right? That green line is a spinal cord, the blues are the discs, and the yellows are the ligaments. So imagine when you're moving your neck, what's actually happening when you have a loss of curve. Check this out. So now we're looking for reds. Look right there, what do you see?
Pink.
Yeah, you see the disc putting pressure on the spinal cord and the ligaments being stretched, right? Imagine you're constantly stretching your ligament, like in your knee. Eventually, your knee becomes inflamed and sore because your ligament's being stretched. It's the same concept here. With the structural pathology that you have in your spine, every time you're moving, you're increasing the pressure and the stress on the disc, the ligaments, and the spinal cord. And the cool thing is that this technology is available these days. These are the things that I use to objectively look at your health because we want to know what factors are contributing. If this is a factor that's contributing, we should be aware of it and also help create the corrections for it because what we don't want is you suffering in pain from an earlier age than you should. I get it when you're in your 40s and 50s having pain because we've lived life, we've had injuries, but someone that's in high school shouldn't be experiencing these things, but unfortunately, you are. So once again, look at this picture here, right? That's where the nerve is coming through. So imagine when you're moving your neck around and there's pressure on that nerve that's affecting not just the muscles you feel, but also internal organ dysfunctions. That's super important. Same as a picture here, right? That's an alar ligament that's being injured in the upper part of the neck. Why? Because of certain traumas, injuries. But I'm seeing this way more in kids that are playing sports, falling off your bed, having car accidents with your parents. These are things that are also detrimental to overall health. Why? Because it's ligament damage, and this is creating symptoms in your body. So once again, if we're able to evaluate this at an earlier age as compared to waiting for the pain to start, we're 2 steps ahead of the game. Got that?
Yeah.
Right. So on tonight's show, we got to talk to a high school student and her experiences of online education versus in-person and the differences that she noticed. Level of education wasn't as good. But the big thing that we got out of this was how much more time she was spending in front of a screen. She said social media was 4 to 5 hours a day and then additional 5 hours of looking down in front of a computer. So she's spending 10 hours a day in front of a computer looking down. And that's a lot. What we did do is we analyzed her posture when she was standing in good posture. She had some postural faults. But then we shot a second posture analyzing what happens when you're looking down. And we saw the difference. It was dramatic from 20 pounds of pressure on the spine to 50 pounds of pressure on the spine. Imagine your kid walking around with 3 bowling balls in front of them, and that's what they're doing. Then we shot her x-ray to look at her spine pathology, see if she had any. And her good lines were not where they're supposed to be. So even at an early age of 14, she's already starting to have spine pathology that's going to cause early on stage arthritis, disc degeneration, neurological compromise. And then we shot a secondary x-ray looking at when she's looking down on her phone again. And what do we see? A worsening of her statistical analysis. This is major. We don't want to wait for our kids to have health problems because you're going to get them. And I've seen that for the last 5 years. So one thing we want to do is prevention. An amazing documentary that I got to be part of was Screened Out. It analyzes what our kids are being involved in, the social, the psychological, the emotional, and the physical ramifications of too much screen time. So once again, thank you for attending tonight's show. I'm Dr. Rob Pomahawk. Stay healthy, LA.